scene. They're on tag 17.
Hello, my name is Jeff Hammerstein with the Wake County EMS system based right here in Raleigh, North Carolina. I'd like to introduce you to our Advanced Practice Paramedic, or APP program, which we implemented here in Wake County in January of 2009. For some, Advanced Practice Paramedic refers to a provider armed with a list of skills and medical procedures that are beyond the typical scope of a paramedic. Our program is less about procedures and equipment and more about experience, knowledge and training, and about preparing our APPs with the tools they need to facilitate additional services for the citizens of and visitors to Wake County. The first function in our APP program is to ensure that we have at least one additional experienced paramedic on the scene of all critical calls. Our APPs respond on Delta and Echo calls as an additional resource that an attending paramedic may turn to for support in a high acuity situation. Since our APPs are experienced paramedics with a high frequency of critical level calls on a routine basis, they are a great tool for our outstanding system paramedics use to help accomplish multiple medical procedures, reflect treatment decisions, or just have an extra set of highly trained hands. The next function of our Advanced Practice Paramedics is preventive care through home visits. To get started, we developed a list of medical conditions that research shows we can have a positive impact on with home visits. Many in EMS have argued that we should not just be reacting to emergencies, but also doing what we can to keep people from getting into a medical crisis in the first place. That's a major objective of our APP program, an EMS version of fire prevention, if you will.
Responded to some of our patients are called due to frequent falls. One of the things that we do when we actually follow up with these individuals is we actually go in, meet with them, and see what is causing them to have frequent falls. If we can, we remove the hazards or put them in a better location so the clients or patients have egress throughout their home or living quarters.
I got this guy that's calling 911 8 or 10 times a month because his blood sugar gets low, and we've been able to go out, find out what the issues are, talk with his doctor, talk with him, network the resources he have in place with his insurance and the county resources, and we've been able to get a solution that's having him call once or twice a month. So it's definitely better than it was.
When we first saw her, like I said, she got short of breath pretty easily, just walking across the floor kind of thing. Now she comes and meets us at the door with a smile on her face. Her color's good. She's glad to see us, and she's doing great.
We have one who was referred for falls. She is in an electric wheelchair and tries to do a lot of stuff by herself because she doesn't have any help at the home. So we go check on her once a week. We also refill her medication dispenser because that's something that she has to get on the floor to do and needs help getting back into her wheelchair.
From a practical standpoint, these patients cross the line between home health nursing and emergency medicine because these are not simple routine follow-ups. These are patients who've had a change. Something's happened. Blood sugar's low, blood sugar's high, and the follow-up from that falls as naturally on the emergency side as it does on the home health side. So the choice really for the community is we take the paramedic who knows the emergency medicine side and give them a little bit of the prevention, or we take the home health nurse and give them a little bit of the emergency side. And analyzing our system and the way it was, it just made more sense to us to take the paramedics and give them that pharmacology and prevention that they need.
How long have you been on the streets? A few weeks.
The third function of the APP program is facilitating alternative destinations. When APPs arrive on the scene of someone in a substance abuse or mental health crisis situation, they may assist the ambulance crew with patient assessment.
Hey Benji, we're out here with the 23-year-old male. He's homeless right now. Been drinking some alcohol. Has no medical complaints whatsoever.
If there are no acute medical care needs, the ambulance will return to service and the APP will assess the patient and use their specialized training to determine the most appropriate facility for further care. The APP can then arrange transportation and admission into one of the many facilities who have partnered with the Wake County EMS system. So, what kind of vehicle do we send out our APPs in? Well, a lot of thought and research went into that selection process. Ultimately, we chose a police package sedan. Wake County EMS Operations Chief John Olson talks about that selection process.
Well,
when we initially started the evaluation of what the vehicle would be, we looked at several different models. Along with that, we looked at the environment and the workload that these folks would be doing. And the logical conclusion was to look to something that's currently being used as a law enforcement vehicle. We mentioned the Impala and the Crown Victoria. We looked at the vehicles that were currently available with law enforcement type packages off of a state purchase contract. We know that the law enforcement vehicles are designed a little bit more heavy duty from a suspension, braking, drivetrain perspective, and we knew we were putting a significant amount of miles on these cars throughout their lifespan. So we wanted something that was going to endure the workload we were going to put into them. We were able to do some comparison between seating room, backseat room, trunk space room, because we knew exactly where our storage and personnel space needs would be at. Put the three of those together into a matrix, and the Charger provided us with the overall best picture when it came to trunk storage, the height of the vehicle in the back when it came to loading and unloading equipment, as well as comfortable and room for the driver up front.
There is, in North Carolina and nationwide, a shortage of paramedics, particularly experienced paramedics. And the evidence that we've examined shows that having an experienced paramedic on critical calls makes a whole lot of difference in how well the patients do. So the APPs are our sort of in-field consulting specialists who, because they will arrive later in an incident, can stand back and sort of examine the checklist and make sure that all the critical items have been attended to and facilitate and assist the work of the ambulance paramedics. I think of the Advanced Practice Paramedic program as the concept of community policing meets EMS. In community policing, police officers go out into the community and try and prevent community problems and prevent crimes before they happen. But they're still police officers, and they're still available to respond to emergencies if they're needed. The Advanced Practice Paramedic program is the same thing. We've got a force of well-trained, competent paramedics, long experience, who can go out in the community and work with the community to prevent and solve medical problems before they turn into medical emergencies. And when they turn into medical emergencies, they can respond and take care of those as well.
I got my start as a volunteer in small town EMS when we went to patients' homes and checked their blood pressure, and as the business has grown, that's changed, and ambulances don't have time to do that anymore. And I think we're putting part of that back into the community. We're actually bringing the community support back to the communities.
EMS as a whole has always been sitting around waiting for the pager to go off and then to go on a call. And this allows us to actually maybe try and make a difference, go to repeat callers and try and fix underlying problems and issues, and perhaps, like I said, take a proactive approach to EMS rather than a reactive approach.
And it's more of a looking out for them, but also we get the opportunity to see patients when they're not at their worst, when they're not having some sort of emergency. To see a patient who is happy to see me, not because they feel they need me, but because they would like to speak to me, is an experience I never thought I'd have. I love my job. I love patient care, so responding on emergencies is still a big priority to me.
I'd say it's great. I absolutely love my job. I get to go out, help people. I do what every paramedic in the world wants to do.